on a day-to-day basis, what I face as a provider is that children are going to come to you sick. So you have to protect yourself from being sick. I clean a lot around here, sanitize a lot, because parents have to go to work, whether they're sick or well. They're going to drop their kids off to daycare. So on a day-to-day basis, I'll have at least one kid come in here with too much cough medicine or too much what, because the parents is going to give them that so they can be all right all day till they get to work. And if they have to come home, they'll come home. But I run into, especially during the changing of the seasons, at any given time, there's 1, 2, 3 kids. They all got colds, and the parents are being home sick with the flu or whatever, but the parent can't go to the doctor because the parent don't have insurance coverage. And this is something that I run into a lot on a day-to-day basis. I do have health care service, but it's not a good health care plan. It's something that just takes, as they say, just to have a card to show the doctor when you go to the doctor. Because they don't want to look at you if you don't have a card, you know. The insurance that I have is AARP, and it pays $115 a month. It does not include dental. It also does not include blood work, lab work, or none of that. Just doctor's visit, and if you happen to get sick and land in the hospital, it'll pay so much a day, or in some kind of, home or something like that, it'll pay so much a day. Other than that, it does not pay dental. Medication, you get a percentage off if you have a prescription. I think it's about 50% maybe off if you have a prescription. But it does not include dental at all. It only covers $60 when I go to the doctor. When the doctor's visit, it's like $95. And if you go to the emergency room, I don't think it still covered at $60. If you have a blood test, and you can only do that 4 times a year, even though you pay out all of the money. You can walk in the hospital dying. They're going to ask you for that insurance card before they ask you for anything. They don't want to know your name. They just want to know if you have insurance. That's it,
Nosotros no, nosotros tenemos que, por nosotros mismos, aunque sea para guardar un dinero para nosotros, pero no lo podemos porque el cuidado de los niños no ganamos como en una compañía que se gana un dinero siempre semanal o al mes. Nosotros no, porque hoy yo puedo tener 5 niños y mañana vienen y me dicen no voy a tener 5 niños, lo que los padres me dicen no lo puede cuidar más y tengo nomás 2 o 3 o 4. No es un dinero fijo y lo que nosotros nos ganamos no es un dinero como un mínimo que se paga una compañía. Muchas veces un padre viene y le dice a uno para el cuidado de un niño y uno le pide una cierta cantidad y ellos dicen que es muy caro y uno va cobrando menos de lo que uno debe ganar.
She is saying that her work, she described her work, her job as a leaky job. Sometimes she have 5, 6 kids, sometimes she have 2 and 3 kids. She don't have a stable income in her home. Many parents that they have to pay the part, they don't want to pay the other part because they understand that they don't have to. So when she summarized the income, she thinks that she's earning less the minimum salary.
A mí me ayudaron para un programa para la mamografía y un examen de mamografía y citología cada año. Entonces yo fui, pero tuve una mala experiencia con esa ayuda, porque me lo dieron fue free. Entonces ahora yo necesito una operación y tengo miedo de ir, porque no quiero pasar lo mismo que pasé antes.
She's very, very, very worried because she don't have insurance. She has a situation of her breast condition that needs an operation. But she's very worried and very concerned because she don't have any insurance.
I spoke to a parent about it yesterday, and she was telling me, you guys don't have health care? I'm like, no, we don't have health care. She didn't really know. I think the parents know very little except for they taking their child to work and they're going to work. They understand what they get on their job. They don't understand what the daycare providers get at all. So healthcare is something that everybody needs. Personally, myself, I don't go to the doctor unless I have the money to pay them, because I'm afraid of doctors treating me and I owe them money. It's maybe just my fear. It might not be nobody else's fear, but it's just something that I have to be very, very sick to go to the doctor without having the money to pay. Owing them a doctor bill and then walk in the office and I owe them money. I won't do that. So maybe with some people they'll do that, and then they'll be fighting to get the money, because they will harass you about a bill if you owe or put a lien on your house. I have people calling you up and that kind of thing. And one of the things I do notice that if you don't have insurance, your bill is always higher than it was if you had insurance, because I've been on both sides of the fence, without insurance and with insurance. And I found that my bill almost doubled, to the point that you just don't go if you don't have insurance.
A mí me salen quistes en el seno, quistes. Entonces yo tengo que estar en chequeo. Entonces como no tengo plan médico ahora, ya llevo 2 años que no he ido a hacerme chequear. Y estoy muy preocupada por eso. Por eso vengo aquí también a apoyar y para que nos ayuden para tener un seguro para nosotros, a todos los proveedores y todas las personas que necesiten, ¿no es cierto?
She's risking her life for the last 2 years because she's not going to the doctor because she don't have any insurance. She don't want to have a free treatment because she have a bad experience last time, and that's why she's here speaking to you, exhorting the provider to be part of this campaign, because all need a universal health campaign. So she invite all the providers to be part of it.
Prior to this insurance, I had Blue Cross, Anthem Blue Cross, and it just kept going up in price every year. I started, it was about $200 and $224 a month, and when I stopped taking it, it was like $489. It just kept going up and up and up until the premiums was just too much. It was best just to put the money in the bank for those trips you have to make to the doctor or whatever. I used to be an asthmatic, and I used to go to the emergency room where the bills would be like $200 and some if you had insurance, or $100 and some if you had insurance. But if you didn't have insurance and you go to the emergency room, the last trip I made to the emergency room, the bill was like $340 some just for that one trip, and 2 Tylenols. That's just the way it is, Universal health care would help a lot of people. I think people would get more services before if they got sick, because my theory is that why go to the doctor if they're not going to do anything anyway? because you don't have insurance, So universal health care would cover everybody. People would be happier. They wouldn't be sick. Parents wouldn't be sick, and kids got coverage on Husky. Parents no coverage. Parents sick and they got healthy kids running around. That doesn't work. I see that with some of the parents that I have that don't have insurance, but the kids are covered on the Husky. So they'll be sick. They'll be at home. They won't go to the doctor. And then I'm like, you're gonna get the kids sick. Then you're gonna bring them here. Then I'm gonna be sick. And everybody up in here is gonna be sick. But a lot of them don't have coverage. I don't think most people understand what universal health care is, because it's something that they haven't been around. I think it's something like, I kind of like understand it because they kind of like have it in Canada, where everybody gets health care services, but I don't think most people really understand what it is.
Por favor, ayúdenos. Se lo pedimos se lo pido yo y en nombre de todos mis compañeros y mis compañeras.
In the name of all the providers, she's asking you, legislators, senators, the Senate, please, she sometime she's a provider for your kids. She's asking you the approval on benefits of all the providers and all the citizens of Connecticut.